Good morning. It's a November morning in Thunder Bay. And just pulling out a block away from Fort William Clinic, where I'm going to be starting the morning. I've already queued up to review a recently discharged patient who we've been working with a family physician there, so I thought it was a good opportunity to join me for my walkthrough and just to let you know what we do and kind of how we do it in Northwestern Ontario with regards to collaborative care. So come on and join me while we walk into this newly opened, less than a year, Fort William Clinic, and we'll meet Dan and probably a few other staff and give you a short tour and let you know how it works. So we are now on the second floor of the Fort William Clinic. So part of the job of what I do with the team is to actually have opportunities to discuss clinical cases outside of direct clinical contact. So I've set up with Dan to talk about somebody who's been recently discharged, and just about on my way into my clinic here to have a conversation with Dan. So come on and join me.
Hey, good morning.
So
Come on in.
I let Shannon know I was going to pop by before things started.
Okay.
So how has Mike been doing since leaving the hospital? Glad you had a chance to update. Sorry to interrupt your
No, thanks for popping by.
Yeah, okay.
All right, thanks.
So heading back to the far end of the clinic here is where the rest of the shared care area is. My office in this lovely new building. And computer on. All right, so I'm finishing reviewing the patient file, and my liaison nurse, primary care liaison nurse, Shelley, is around the corner, just finishing up. So we have arranged to split this consultation. So we have arrangements that we share and co-dictate on the psychiatric assessments. So I'm just about ready. She's 40 minutes in to the assessment, so we're going to go visit her and see if she's ready to review the clinical findings and the consultation impressions that she has. All right. Hi, Shelley. So is your preference for us to review the patient in the room, or would you like to step out?
I would like to step out.
Okay, all right. So let me know when you're ready.
Okay.
Hi, Shelley. Come on in.
Hi, thanks. All right, so I think Karen's doing really well.
Good. All right, so that's great. It's nice to have things working well, and so we'll go in and see Karen right now and kind of firm up the impressions that you got, and then we'll talk with Dr. G after that.
Sounds good.
Great. All right. see if he's in. Got a few
Hi.
minutes? We're just got a couple patients to talk with you about.
Sure, come on in.
So Shelley and I saw Karen,
Okay, yep.
and we're here to talk about that assessment this morning,
Okay,
and also the recently discharged patient that Dan checked in with me on this morning.
right, okay.
So is that
Yep.
okay? So let me know, and it's good. I'm glad it's gone well with these two, and
Yeah.
it doesn't always work that way. But
No,
it's,
no, it
it's
doesn't.
good. Yeah. So.
Have you got a minute, just one
Yeah,
other?
Yeah.
I taught you very briefly, but just remind me, a couple adult patients with ADD who have been off medication, now that they've come back 5-10 years later, want to be restarted.
Thanks, James.
Yeah, great.
Be in touch.
Okay, have a good day.
Okay. Thank you for joining me to view this video of the first hour of our clinical day at the Fort Wayne Clinic doing our shared care or collaborative mental health care model. I hope you had a chance to see, and I think it was well portrayed, the importance we place on access to services, the importance to receive psychiatric and other mental health care counseling in a timely way. In part, that efficiency is due to being able to provide direct face-to-face care, as well as provide guidance and treatment suggestions for indirect services through case discussions or reviews. What I don't think was as well emphasized, but is a part of the care, important to it, is knowledge increasing in the primary care provider in the diagnosis and treatment of mental illness. Further, the centrality of the primary care provider was important to this model to grow and be successful. I think that the first hour reflects what the many parts of this model of care portray in other parts of Canada, and I encourage you to consider reviewing what those sites have to offer. Thank you for joining us and having a chance to view collaborative care in action.